Welcome to Everyday Nursing Knowledge Lectures, and today we will learn IV paralytics. What is IV paralytics? IV paralytics are also called neuromuscular blocking agent. It paralyzes skeletal muscles. Skeletal muscle are muscles connected to the skeletal, and it helps to move limbs and other parts of the body. It does not. IV paralytics has no effect on the cardiac and smooth muscles. Also, it does not has analgesic or anesthetic properties. That means it does not sedate the patient. It does not control the pain level of the patient. So prior to giving IV paralytics, you may have to give IV sedation. Now, what is the mechanism of action? For a muscle to contract, there should be a nerve impulse, and that should pass from the neuron to the muscle. And a nerve impulse is transmitted to the muscle through acetylcholine, and it's a neurotransmitter. When acetylcholine gets transferred from the neuron, it gets bind to the receptors in the muscles. As a result, sodium channel opens up and the muscles contract. This is followed by an action potential. Action potential means there's an electrical activity happens in and out of the membrane. Sodium moves in. As a result, potassium moves out, followed by muscle relaxation. But what happens when you give IV paralytics? The IV paralytics bind to the receptors. So acetylcholine, the neurotransmitter, cannot bind, so it blocks the neurotransmission. When neurotransmission is blocked, that leads to skeletal muscle paralysis. Now the sequence of paralysis. When IV push is given or IV paralytic is given, it initially paralyzes smaller muscles, example eyes and face, then larger muscles of limbs and trunk, and finally respiratory muscles, intercostal muscles and diaphragm. And when a patient recovers from IV paralytics, it goes in the reverse order. Now, what are the indications of IV paralytics? It is given prior to intubation to facilitate intubation, to relax or paralyze the muscles, and for easy intubation. For surgeries, it is used during electroconvulsive therapy. It's a psychiatric treatment, and it is used to prevent muscle injury. IV paralytics is used to control shivering and hypothermia. Post-cardiac arrest patient, to preserve neurofunction, you cool the patient down, and as a result, patient can have shivering that increases the oxygen demand. So IV paralytics are given to prevent shivering and to decrease oxygen consumption. In mechanically ventilated patients, example in severe ARDS, COVID-19 patient, when they are intubated, prone, we use IV paralytics for better outcome. Now, what are the types? It has two types, depolarizing and non-depolarizing. The example for depolarizing neuromuscular blocking agent is succinylcholine. The trade name is anactin. An example for non-depolarizing neuromuscular blocking agent is rocuronium, Zemaron, acronium, Norcuron, mivacurium, mivacron, atracurium, tracurium, cis-atracurium, Nimbex, pancuronium, Pavilon. Now the mechanism of action. In depolarizing neuromuscular blocking agent, the IV paralytics binds to the receptors, and initially it activates the muscle. So it causes initial muscle contraction, but the IV paralytics stays bound to these receptors. So acetylcholine cannot come and attach. So it blocks the neurotransmission that leads to paralysis of the muscles. Whereas in non-depolarizing, again, IV paralytics bind to the receptors, but it does not activate the muscles. It does not cause muscle contraction. It stays bound and prevent acetylcholine from binding, and that leads to blocking the neurotransmission and paralysis of the muscles. Now, succinylcholine is the only depolarizing neuromuscular blocking agent. It is also called anactin. It is commonly used for or during intubation as an IV push. The reason is because of its rapid onset of action. It acts fast. That means it start acting within less than 60 seconds. And patients start recovering within 4 to 5 minutes, and complete reversal of the medicine is obtained within 10 to 12 minutes. The side effects include hyperkalemia. This is because of initially it causes systemic muscle contraction. As a result, always remember there is an action potential. Sodium moves in, potassium moves out. That can lead to hyperkalemia. Another rare side effect is malignant hyperthermia. That means systemic muscle contraction, increased body temperature, and tachycardia. It is contraindicated in rhabdomyolysis because there is an existing muscle injury, also in acute kidney injury. When you give succinylcholine, you will see a brief muscle twitching. This is because initially it activates the muscle, causing muscle twitching. This is known as fasciculation. Fasciculation means temporary muscle twitching. Now, the non-depolarizing neuromuscular blocking agent, among those most commonly used are rocuronium, vacuronium, and cis-atracurium. Rocuronium is used as an IV push. Vacuronium and cis-atracurium are used as IV drips. Vacuronium is also used as IV push. Myvacurium. If you look at the onset of action, it has few minutes. It all has less than 5 to 6 minutes, and duration also stays around minutes. The only short-acting non-depolarizing neuromuscular blocking agent is myvacurium. Rocuronium, vacuronium, atracurium, and cis-atracurium are intermediate acting, and pancuronium is the only long-acting. Now, rocuronium. Rocuronium is used as an IV push, same like succinylcholine during intubation, because of the rapid onset of action, and the duration of action stays within 30 to 40 minutes. Now, vacuronium. It is 6 times potent than roc. It is used as IV push and drip, and the rate is anywhere from 0.8 to 2 mics per kg per minute. Atracurium has a side effect of histamine release, so not widely used. The side effect includes tachycardia, hypertension, and flushing. Cis-atracurium is another drug most commonly used as an IV drip in ICU. And if you're using as an IV drip, the rate is anywhere from 2 to 10 mics per kg per minute. Pancuronium is the only long-acting non-depolarizing neuromuscular blocking agent. So today we learned about IV paralytics, and thanks for watching my video.